Hi everybody, welcome to my channel. If you're new here, welcome in. If you're returning, I'm glad to see you again. I thought today we could talk about HIPAA. It's a very big topic in nursing, and I would ask that if you like my videos and you are interested in the things that I talk about, like, subscribe, and follow, and comment below, please. And also, I just want to add a disclaimer that everything I say is my own personal opinion based from my own personal experience. I'm not a doctor. I'm not an expert. I'm just somebody sharing my story. So let's talk about HIPAA. You know, in home care, we are still responsible to abide by HIPAA. What is HIPAA? It is the Health Insurance Portability something Act. Okay, but basically what it's saying is only the people who are designated to have this information about your health should have this information. What that means for a patient is that everybody doesn't get information about them. And that means who the patient deems as necessary to receive that information. The patient has to give permission to get information. Same thing for us as patients in the world. If we don't want our sister to know our business, we have a right to keep that from our sister, right? So the thing in healthcare, in home care, in home hospice, like I deal with, you're going to people's homes and inadvertently you'll run into people's neighbors. Sometimes neighbors will ask you about their neighbor and they feel entitled to that information. It feels to me. I've had people ask me about their neighbor and, you know, how they're doing, etc., etc. I always refer them back to the family. I have said, yes, they're fine, and panic before. But ultimately, the people who should be giving the neighbors that information is not me, because I have not been released to give that information to the neighbors. When we are looking at our patient's chart, that information is privileged. Anything that we're reading about our patient is privileged private information. And just because somebody that goes to the same church runs into you and recognizes that you're the person caring for that patient doesn't mean they're entitled to that information about the patient. People get really upset when you don't tell them what they want to know. They feel like they are close personal friends and they are offended that you're not going to give them that information. When I worked in a facility, we did not give information out if it was not expressly stated so in the chart. And that means a daughter, a son, a husband, a wife, whoever is not designated to get that information could not get that information without talking to the patient or the person who was designated to receive that information. And that's really hard because I know those neighbors obviously have some type of relationship with our patients, right? The neighbors see the patient, they interact with them, maybe they go to lunch with them sometimes. At the end of the day, it is up to the patient and the patient's designated people to give that information. We, as healthcare workers, cannot give information to people. And that includes, you know, we have to have a release to give information to anyone in healthcare. We can't be talking at the grocery store about our patient, even if we mutually, say it's someone who's visited while you're there seeing the patient. You still are not at liberty to discuss the patient without that patient expressly saying that you are permitted to discuss them. And also, when we're thinking about privacy, how private is it to be talking about your patient in a grocery store? I certainly don't want anyone knowing my health information in the grocery store. You know, it's hard to keep your health information private. We're in a public setting sometimes. You just have to be diligent to keep that information private. In facilities, they have a lot of safeguards in place for that. That's not to say that information doesn't get given inadvertently. It happens. It happens. And if it does happen, just know you could be held accountable for it. Patients sometimes have dynamics that we're not aware of. Sometimes the relationship they have with the other people that want this information are harmful and could cause the patient harm. We don't know our patients on a personal level generally. Generally, we're meeting our patients on a professional level about their health care. And we don't know the dynamics that are going on behind the scenes a lot of times. So we don't really know what giving that information could do. Could it harm the patient? Would it ruin your relationship with the patient, their trust in you? Those are not the biggest things. I mean, basically, we don't have a right to give that information unless the patient says it's okay or their designated person says it's okay. Now, I've been in situations where I don't have it on a piece of paper, but the designated person is in the room and says, hey, yes, you're free to talk about this. Because when you're in a situation where you have people who are not in the healthcare designated list, or they are not in the chart, and maybe you're not aware of what they know about the patient, it's important to say, hey, is it okay for me to talk in front of this person? Because I've had family members say to someone, hey, could you step outside for a little bit while we go through these things, while we do these things? Patients have a right to their privacy. They have a right to not have their health information shared, and that includes on the unit to people that are not giving the patient care. Have you ever worked in a situation where you knew about the patient in room A that had such and such condition, but really you were not authorized to have that information? And this is just a what if example. When we work in a unit with other people, the people that work with us often feel that they're entitled to know that too. Now, if you are having someone watch over your patient while you go to lunch, obviously the person who's taking over for you while you take that break has things that they need to know. You know, the people that are involved in the care team have the right to know, but everybody on the unit that's working does not need to know specifically what's going on with the patient's health. It is not their business. And patients have a right to have this information to themselves. And that means if they have HIV, if they have hepatitis, if they have COVID, whatever they have a right to have that information protected. As healthcare workers, we're supposed to assume that anybody could have something infectious, right? We're supposed to treat everybody like it could potentially be infectious because we're coming into contact with bodily fluids. We're coming into contact with, wounds. We're coming into contact with things that we should not be touching without gloves. When you're giving a patient care, you should be wearing gloves, just so you know. So I digress, but what I'm saying is whatever a person has in their health care chart, only the people who need to know should know those things. We shouldn't be discussing it with anybody on our unit that's not involved in the patient's care, with anybody in the neighborhood that's not included in the care plan. When we're doing a chart, when we're admitting someone into a hospice setting, we say, who can have information about you? Who are the people that you're okay with us sharing your information about? Because if they're not in the chart, we're not going to share that information, right? We're not going to give somebody information if they're not permitted to receive that information. HIPAA. It's a big thing. It came about in 1996, but I started in healthcare as a CNA in 1997, a long time ago. And I don't remember really HIPAA being pushed. I know it was always there. But I remember in the 2000s is when I, as a patient, started receiving the HIPAA Act and signing that, letting me know that my information would be protected and letting me know that I had the right to that privacy. And my patients, when I am a nurse in the facilities or in the healthcare, in home care, my patients get to know about the HIPAA Act and what rights are protected. Now, provider to provider have to share information related to the patient. And this is something that's included in those consents that patients sign. That's why it's very important to know that your patient is alert and oriented and understands what they're signing. It's very important to know if a power of attorney is activated, if a person has capacity, and who is signing what. But those people have the right to know what their rights are regarding their privacy and who's going to get their information. Provider to provider is going to share information together, and oftentimes patients do sign a release so that that can happen. We need that information to provide the best level of care, but your brother doesn't necessarily get to come in and get that information. So if you want your brother or your sister or your mother or your father or your husband, your wife, your children, if you want them to have that information, it needs to be made very clear in the chart. So we need to always be diligent. When a person calls and says, I'm so-and-so's sister, I'm so-and-so's aunt, I'm so-and-so's uncle, I'm their child, it's very important to look in the chart and know, am I permitted to give this person information? Because it can lead to legal action. It can. If you violate a patient's privacy, it can lead to you losing your job, it can lead to disciplinary action, it can lead to legal action. Our patients understand and are told that they have a right to their privacy. And that's very important to protect. As nurses, I've said many times that we're advocates, and part of advocating for your patient is making sure that their information is protected and it's not going to the people who don't have access to that information, who shouldn't have access to that information. I promise you that when you speak to someone who doesn't have access to that information, that is a family member, you may get verbally assaulted on the phone. People may be threatening toward you, but you have to stand your ground. If a person does not have permission to have that information, you shouldn't be giving it. Now, if your patient's alert and oriented, you can always go to the patient and say, hey, your brother's here. Is it okay if I share any information with your brother today? It is okay to ask a patient who's alert and oriented, but if a person comes and they're not on the chart and they're saying, hey, my sister said I can have access to this information, you better be looking to see if the sister's on the chart and calling the sister. Because ultimately, no matter what a person is telling you, if they're not in the chart to get that information, if there's not a piece of paper saying that they're allowed to have that information or a name on the screen, however it may be, you cannot give that information. You want to be helpful. We're nurses, we're healthcare workers, we want to help people. We don't want to disappoint people. We don't want to make people angry. We don't want to, rock the boat sometimes. But if you tell one of my cousins about my health information and I didn't give you permission to, I'm going to be angry as a patient myself. So just think about yourself as a patient. I always say, that we should treat our patients the way we would treat our loved ones, the way we would expect ourselves to be treated. That's very important in healthcare. Not saying that always happens. We have bad days. We do things where we're not, but in the grand scheme of things, we should be thinking about our patients, how we would think about ourselves, how we would want to be treated. Do unto others as you would have them do unto you. So, what's a time that you encountered a family member that was aggressive toward you, or a friend or a neighbor? How did you handle that? Did you cave and give the information, or were you able to stand your ground and be polite and refuse that information and direct them to the right people? It's a very tricky, touchy subject, but I'd love to hear about it in the comments, and I'd love to talk about it more. What are some tips and tricks that you have for dealing with family members, friends, people who shouldn't have access to the healthcare information? But the patient may want to see them. Do you direct them to the patient? How do you handle those types of things? Love to talk about it. And I thank you for watching. If you're interested in more content from me about my opinions, my experiences, my nursing journey, then I would ask that you like, subscribe, and follow. And I hope to see you soon. Bye-bye.